I think it's really clear that moral suffering is part of our work as clinicians, and I think it shows up in so many different ways. And the way I like to think about it is moral suffering is sort of the umbrella, and underneath that, these other terms, moral distress, moral injury, sort of reside. So in a broad sense, I think about moral suffering as the anguish that we experience. And there's a whole range of moral harms or wrongs or failures that occur in our work. And all of that sort of context, I think, is what erodes our sense of integrity. And I think that sense of wholeness, that sense of threat or violation is really where we start to see this anguish and distress. So if you think about in COVID, the kind of moral adversity in terms of not having the equipment and the protective devices that we need to do our jobs, the sense of, in many ways, clinicians having to take on sort of emotional labor on behalf of their patients because families are not there with them, patients dying alone. So many types of moral adversity are present, and that adversity often imperils our integrity in some way or another. In a sort of, continuum, initially we experience what I would call moral stress, that period of feeling discomfort, disquieted about what are we doing, how am I to respond to these threats to what I'm supposed to be doing. So when that's not relieved, then that's when I think we really experience different forms of moral suffering.